Hi, my name is Grace DeFore, and I'm going to be going over cystic fibrosis, the causes, the symptoms, and how to manage your symptoms. So, just a general overview. This is an autosomal recessive disease, meaning it is the recessive allele that contributes to this disease. Both parents need to be carriers of the disease, however, they will not have cystic fibrosis as it is a recessive disease. Some of the phenotypic features or symptoms that cystic fibrosis patients will have is salty skin, persistent coughing, frequent lung infections, wheezing or shortness of breath, poor growth or weight gain, trouble with bowel movements, and male infertility. And most of these symptoms stem from issues with the lungs and pancreas. So one example of somebody who has experienced the diagnostic procedure and treatment is Mackenzie. She was an 11-year-old girl. She was an athlete, lived a normal life. However, one thing really bothered her, and that was the frequent coughing. So she went into the doctor to get it checked out, see what was wrong, if she was allergic to anything. And immediately the doctor recognized these symptoms in her. She had the chronic coughing, clubbed fingers, stunted growth, and salty skin. So as the doctor discovered these symptoms, she sent her in for more testing. So she underwent a lung function test, an x-ray test, a sweat test, and a genetics test. So the lung function showed very poor performance. The lung test showed major abnormalities that pointed to cystic fibrosis. And the sweat test, it looks for levels of chloride in the skin post-workout, and her levels were very high. And then the genetics test showed that both of her parents were carriers, and she did show mutations that lined up with cystic fibrosis. So she was diagnosed with cystic fibrosis at the age of 11. To manage these symptoms, she underwent airway clearance treatments, a bronchodilator, concentrated saline solution, pancreatic enzymes, antibiotics, an oral medication, and an inhaled medication. So it is a very taxing management of cystic fibrosis. However, there is no solution for cystic fibrosis at this time. So a little bit about the causes of cystic fibrosis. The most common cause that you will see is the deletion of the phenylalanine 508 in the cystic fibrosis conductance transmembrane regulator. And this will cause defective synthesis of the CFTR protein. So we also have this photo right here where it shows the deleted base. And even though this is the most common cause of cystic fibrosis, there are more than 1,800 different mutations that can cause cystic fibrosis, and depending on the mutation that an individual has, it can affect the severity of their symptoms. And it is a pretty rare disease. There are about 70,000 cases worldwide. So a little bit about the diagnostic procedures. As of 2007, it became required for all newborns to undergo a screening test for cystic fibrosis, and this is typically done in the form of a blood test, and we see that down here. And then they also have sweat tests like Mackenzie went through. Like I said, it measures the level of chloride in the individual sweat, and then we have a photo of that here. The genetics test is the most open and shut way of diagnosing cystic fibrosis. We are able to look for specific mutations that match up with cystic fibrosis, and then there's also just a generic evaluation of symptoms. So as I said earlier, there is no cure for cystic fibrosis, but there are ways to manage the symptoms. And because the severity and different mutations of cystic fibrosis, there are different treatment plans unique to each individual. So one of the treatment plans is airway clearance, and these are techniques to loosen up mucus in the lungs. And this will help their breathing. And we have this little boy who is wearing the airway clearance treatment. And then there's inhaled medicine, and this is normally in the form of an inhaler, and this is used to open airways, and it also includes antibiotics. They have pancreatic enzyme supplements, and these will be taken with each meal, each time they have their food, to improve their absorption of nutrients, and this can help with their growth. A fitness plan, this just helps to improve their energy and health, and the CFTR modulators are really awesome, but they're only used for certain mutations, and this targets the defect in the CFTR protein and just tries to fix it. So heredity, this is how it's passed on from mother and father to offspring. So as I said earlier, both of the parents must be carriers. And so with their offspring, there's a 25% chance that the child will have CF. There's a 25% chance they will not have cystic fibrosis and will not be a carrier, and then a 50% chance they will just be a carrier but not show symptoms of cystic fibrosis. So this is the phylogenetic tree for the CTFR gene, and you can see the length of these lines indicate time, and these groups are common ancestors, and it goes all the way back into the bacteria back here and as it progressed through time. And then we have our references that I've used throughout this PowerPoint, so hopefully you learned more about the causes of cystic fibrosis and what exactly it entails.